Welcome to 101. I'm Greg Bassett, your host from the Salisbury Independent newspaper. It's a big day here at PAC 14. We've got a new friend in the house, Kat Rodgers. She's the director of community health for TidalHealth here in Salisbury. Welcome, Kat.
Hey, thanks for having me.
So, what are you in here to talk about?
Health screenings and how important they are.
We don't need those. We're fine until we're sick and we just go to the doctor. We don't need to
Right.
screen anything.
Yeah, well, my job at TidalHealth is to try to keep people out of the hospital and to promote health and wellness. And one way we're doing that is by partnering with MAC and their upcoming Aging Expo 50th anniversary and bringing HealthFest to the Civic Center.
So, the HealthFest that used to be at the high school is now going to the Civic Center.
That's right, just for this transition year, trying to get it up and going again. So it'll be smaller scale. We hope to expand it back out at the high school next year, but we've got a lot of really cool stuff planned.
So, tell us some details about why these health screenings are important.
Health prevention and screenings are so important to prevent a number of chronic disease, and millions of Americans go without them, but they're important for every age, from childhood up into the elderly. And so we're going to have a number of different basic health screenings available at HealthFest that can really give people the tools and information they need to take control of their health and live their best life.
Now, why are people so indifferent or afraid to do these health screenings? Everyone will have these little symptoms and they kind of ignore them or brush them aside. Then they find out later that they could have done something about it early and saved lots of trauma with that. But they won't come forward. They won't take advantage of this stuff like they should.
I think it's just about education. So that's what we hope to do here at HealthFest. One of the screenings we'll be doing is a diabetes risk assessment. So it's a very simple questionnaire and it assesses people based on their age, family history, their BMI or their weight, their ethnicity, their race can play a factor, and it calculates how at risk you are for type 2 diabetes. Then we can take that information, and at HealthFest, if they are at high risk because of the score on the survey, they could actually get blood drawn, get an A1C, and it analyzes their blood sugar from the past 3 months. So it gives you all this information just so you can make better choices.
So we were at the Health Council this week, and Steve Leonard said that they're getting patients at TidalHealth Peninsula Regional right now that are very ill because they were not seeing doctors during the pandemic, and their conditions advanced during this time. Whereas if they had been able to go to doctors or have health screenings, which they should have, they would not be as sick as they are now.
That's right. People went without preventative care. That was the first thing to go. And I think people have been slow to return to that and to talk to their primary care doctors, just because, especially for the elderly, they've been isolated for so long. And if you don't, many things you don't have symptoms for, like high blood pressure. They call it the silent killer. You wouldn't even know that you have hypertension or high blood pressure unless you got your blood pressure checked. So just something as basic as that. And hypertension is preventative with eating right, moving more. It's very simple. It's something that people really need to know what their numbers are, where they're at, and then talk with their medical professional, their primary care doctor about what that means and how they can manage it.
I've had a problem just last year. My little pinky toe on my right foot has been hurting. And I was with a doctor friend recently and I said, this toe's hurting. He's like, that's pre-diabetic symptom. Go get a screening. And I would have gone like another year or 2 years and then probably had a stroke, not knowing that what I had was something that was treatable and preventable, and I just probably needed to lose weight and change my diet to keep it from happening. But it was just a happenstance conversation that made me think I need to go get a health screening.
Yeah, pre-diabetes is a great example. With that diabetes risk assessment test that I told you about, we'll be able to tell if you're at risk for pre-diabetes, which does make you at higher risk for type 2 diabetes, for heart disease, for stroke. And I'd say, I think 80% of Americans who have pre-diabetes don't know they have it, and close to a third of all adults have pre-diabetes. So that means that they're on the track to an unhealthy path, but there's good news. it's preventable, just
Right.
like you said,
Right.
with diet and exercise. And by diet, I don't mean restricting what you eat. I just mean being more knowledgeable and making healthier choices for you. Making small changes. Small changes add up to big changes, and just moving more. Physical activity doesn't mean you have to go out and run on a treadmill every day. It's just about being active, living an active lifestyle.
Right, and one of the things too that came out from the Health Council, they were talking about the residence program, this residency program is coming here with doctors in training, and that our area is interesting to doctors who want to learn more because our population, for some reason, has a wide variety of different diseases that they can learn about. So you look at the culture of the Eastern Shore, where there's a lot of sun damage with farmers and watermen being out in the sun all the time. We eat a lot of fried food, just naturally for some reason. We put sugar in all of our food for some reason. Our water table's high, so we're not always drinking the best water in some of the communities in the rural areas. That might have a factor. Cancer rates are higher here than some other places. So those are all challenges that you face as the Director of Community Health in helping people learn what their problems might be.
Yeah, and in fact, people can learn more about the residency program if they come out. We'll have a Ask the Doctor station. We'll have someone talking about that new residency program. We'll have an Ask a Pharmacist. So there'll be a lot of different clinical professionals to interact with. There'll be registered dietitians there, nurses, and you mentioned a lot of different conditions on the Eastern Shore that they're interested in. We do have high rates of cancer. You talked about sun damage, skin cancer, lung cancer. So people from the Richard A. Henson Cancer Institute will be on hand talking about the guidelines and when it's appropriate to get specific cancer screenings depending on your age and your gender.
The blood bank is going to be at the expo.
That's right. So people will be able to have some blood drawn for their screenings, but the blood bank, this is the first time ever the blood bank of Delmarva has partnered with TidalHealth and HealthFest. So we're really excited that they're going to be here. Just like with the other things we were talking about, changes in COVID, less people have been donating. So
Right.
we're at a critical need. And so we do hope that people come out and at least participate in that. The blood bank will be running from 9 to 2 and no pre-registrations required.
So when the blood bank is there, they're actually going to be accepting donations? I can donate blood while I'm there?
Yeah, they'll be all set up with chairs and the people will be able to donate blood on site. So we hope that people come out. That actually will begin an hour earlier, so that will be running from 9 to 2.
How can I establish a relationship with the hospital so I can have access to the program so I know what's going on and I know where I can get screenings and what they're for?
I would say that you should sign up for MyChart. Have you heard about MyChart?
I'm on MyChart, yes.
Okay, so that is a great way to communicate with TidalHealth, to communicate with your provider, to ask questions about your medication, to receive alerts and notifications. We're doing a lot more through that electronic platform, and there's going to be people talking about that too. But as far as trying to know what other activities we have going on at TidalHealth, we try to share that pretty widely. We are focused on reaching people who are underserved, who are in poor communities, who don't have transportation, who don't have access to internet. So a lot of our focus right now with community health is trying to get into places, build trust and awareness, and do some screenings out in the community. But HealthFest is an opportunity to promote health and wellness and make it fun.
Right.
We're going to have mascots there. We're going to have pet therapy dogs, lots of other interactive things. We'll have a clown. So it really is for all ages and about preventative health for all ages.
And your newsletter that comes to my house twice a year, 3 times, whatever it is, quarterly, is an excellent source of information about what's going on at Peninsula Regional and throughout TidalHealth and what programs are available.
That's right. And I think that goes out to a lot of people throughout our service area. And we're always trying to listen to what the community needs and meet those needs because we are all from here. We live here. It's all about our family, friends, and neighbors. And by adding new services, new providers, new hospitals and doctors' offices, we're all just trying to be better together and grow together.
And United Way will be there with one of their exhibits.
Yeah, it's like a mobile art exhibit with artwork from high schoolers throughout the area, sort of in their response and their reaction to the opioid epidemic. So that's going to be an exciting feature too. There's really just so many things. I'm sure I'm going to forget mentioning all the aspects of the HealthFest, and that's just one little piece of this large event that MAC is hosting at the Civic Center.
Now, you've worked in healthcare, emergency medical stuff for years, doing information and stuff. It's really what you're good at. Why did you pick health as something that you want to help spread the word on?
Well, I switched over from emergency management and communications during 2009 during the H1N1 epidemic, and learned all about what public health did in response to an emergency, and just absolutely fell in love with it. I went back to school for it, got my master's in public health, and worked at the health department for a very, very long time. But then I've watched how over the most recent years, hospitals have totally changed how they operate, and population health has become a priority for hospitals. So now, instead of being about volume and bringing people into the hospital and moving them through the ED, it's about what do we do to work with our partners in the community to keep people out of the hospital? What do we do? Let's go upstream. How do we address social determinants of health, transportation, food, housing, so that people can be healthier from the get-go and create equity and equitable access to healthcare. So that's what I'm passionate about, and so I'm very lucky to be able to do that work at TidalHealth.
Well, it's so funny because people don't understand that. So I actually had a senior citizen tell me recently that she was tired of the hospital calling her all the time and asking how she is. So she had been in the hospital. She's in a follow-up program.
Mm-hmm.
They wanted to know how and she just felt bothered by that. And of course, what her thinking was, they want me to come and get tested because they want to charge me more money because they're trying to make money off of this. And I was like, no, they just want to screen you. They want to keep you healthy so you don't go to the hospital and cost all that money, as opposed to like ignoring your symptoms and then having to go and having a big traumatic ordeal at the hospital. They're trying to keep you out of the hospital. And the person just could not comprehend that as a business, that's what the hospital was trying to achieve.
Yeah, about preventing, trying to identify a trigger, an emergent issue before it becomes an issue, to save everybody time and money and energy, so that people can be healthy and happy in their own homes. That's exactly right. And I think you're right. People don't realize that's what the health system's all about. That's what population health is all about. It's not about just, we want to be here when you need us. We want to be here when you're in the crisis situation and all of those situations, but we're also trying to help promote health, wellness, prevention, so that we can be a healthier community as a whole.
TidalHealth did so much to keep us informed during the pandemic, and to help clear the way in terms of what was real and what wasn't real and all that whole debate. What was it like at the hospital dealing with the COVID situation?
So I will preface this with saying that I'm not clinical. I'm not on the treatment side, so that's a whole different story. But what I can tell you is that I was on the COVID vaccination side. So what we saw was that the health departments, which would normally be the first to pass for a mass vaccination effort, they weren't set up and able to sort of ramp up the way we were to get it to the healthcare workers who needed to get the vaccine first. So we were able to be a little bit more nimble and ramp up and scale up and be able to get vaccine out as fast as we were getting it in and move people through. But what we've seen over the past 2 years is just people changing their priorities and listening more, and trying to help each other and be more understanding. And we're having conversations about wellness in terms of resiliency and self-care, and not used to having these conversations with healthcare providers and nurses on the front line, but mental health has risen to the forefront, and just trying to learn how to be there for each other, because everybody's coming from a different space. in the COVID pandemic, and it's affecting everyone at a personal level and then at work too. So
Right. What I sort of saw was, when in a time of need, of real need, the community was able to turn to the hospital, and it wasn't this icy business hospital. It was a community support mechanism through this thing.
Yeah, we did step up and play a community support role by doing those initial mass vaccination clinics, and then it gave time for the infrastructure throughout the state, the public health infrastructure, to scale up so that then they could take that on, and then we could continue to work with special populations or take our Wagner Wellness Band out and support, sort of supplement what the health department would keep on doing.
Okay, give me one more plug for the My TidalHealth, because I think it's so important that people be on there and using it.
So to sign up for my chart on mytidalhealth.org, yes, I think you go to the right-hand side, you can say patient login, click there, and it will give you the instructions for how to sign up for my chart. If you're not so good, trying to navigate a website yourself, but you're planning on coming out to the event Saturday, June 11th, there will be people there to demonstrate and to show you online and walk you through it, or even help you sign up, because I like it too. Because it used to be that you had to call and wait to make an appointment, or you just needed a refill for medicine for your headaches, right? But now it just shoot a simple message and they respond right away.
It's amazing.
Yeah, it's really about not seeing patients as patients,
right,
but as partners, and empowering them in their own health care. Yeah. As an adult. I'm even trying to get away from using the word patient in a lot of the work that we do with community health, because you're a participant.
Right.
You're a participant in your healthcare experience. So
right.
That's great.
So tell us again about the big event that's coming up on June 11th.
So it's HealthFest in partnership with Mac's 50th celebration, and there's going to be lots of fun, something for everybody, really promoting health, wellness, and the importance of preventative health screenings. The health screenings will be in the Flanders Room from 10 to 2.
She's Kat Rodgers. She's the Director of Community Health for TidalHealth Peninsula Regional, and we're thrilled that she had time to be with us here today to promote MAC and all the services at the hospital. Thanks so much for being here.
Thank you.
I'm Greg Bassett from the Salisbury Independent newspaper. Another edition of 101 right here on PAC 14.
First Shore Federal is proud to support PAC 14 and one-on-one. We'd encourage every business to support PAC 14 and pick a program and support it, and let's make a difference.